how's business been in the pandemic, and how are you handling the broadband situation and trying to get people plugged in when you're not really supposed to be in their houses?
Yeah, we were listed as an essential service. That's one thing that allowed us to continue operating. But it is a challenge. We've got the safety of our employees to worry about, and they go into a different person's house 5, 6, 8 times a day, and that's been a big challenge for us. With the need of broadband today, everybody wants it. They want it now, and the scheduling makes it just even that much more difficult.
We've had the same issue with trying to get with clients or customers, existing customers or new sales. We find offices are shut down, or they're not allowing anybody inside. Even if we're going to collect samples, we're not allowed to sign in or visit with anybody anymore. You call at the gate, they let you in to get anything done, and you're done from there. No human interaction anymore. And that's really the saddest part, because that was one of the biggest parts of my job, was interacting with the customers, and I enjoyed it. And so I can feel the same way for the kids that aren't allowed to go to school, that are missing the interaction with their friends that
Sure.
they only saw at school.
Sure.
And so, yes, it's good that you can get them access online, but online school isn't for everybody, I believe.
No, they're missing out on the human touch, and social interaction for kids is big. I totally agree.
I have a small printing company, and I did the math work at the end of the month last month, and I'm down 38%, which sounds like a lot, but I feel blessed because there are some businesses that are down 75%, or they have closed down totally. I have had to lay off one of my employees and cut my other employee down to half the time that she usually works.
In the healthcare profession, we're getting quite burned out on caring for this. There's a serious toll that's played on healthcare providers from having to be separated from each other, those taking care of COVID, those not taking care of COVID, the constant regulations and requirements. For the past month, we've been shut down on all of our elective surgeries. So there are people in Lea County who have not been able to have elective surgery for the, if you were coming up on your deductible and you said, hey, I want to get a surgery finished up before the end of the year so I can have that apply, you wouldn't have been able to in New Mexico the end of this year. So there's a number of things where if we can make some progress on lessening our positivity rate, which Lea County is one of the higher ones in the state, if not the highest, pretty consistently. We've expanded our capacity a little bit with some staffing help that we've had with some additional nurses who are able to care for us. But we were having to send patients to Phoenix and Oklahoma City and all these places who were positive for COVID because there was nowhere to take care of them.
Oh, wow. Okay.
And so we were stressed. We were kind of stressed to the max on where we were able to really care for people. So if you think of that, I mean, like right now, we can only have one visitor in the hospital at a time. So you're going to the hospital right now, and let's say you do have COVID, you're not getting any visitors. So you're an older adult who might be lonely anyway, or scared, or not really sure what hospital. So you're coming into the hospital, and now you're not only going to the hospital, which is a scary thing, but you're getting shipped to Oklahoma City or something that's an 8-hour drive away, or Phoenix, Arizona, it's an 11-hour drive away, and you've got none of your family with you. They can't travel with you when you go on the helicopter or whatever. So there's a lot of things that really stress us out, and then trying to figure out how somebody gets home from Tucson or Phoenix to get back here to be able to continue their treatment, and because they're on oxygen, so they can't just drive home, so they've got to have a medical transport. So it really has provided a complex environment for us to solve some of these problems that hopefully we can, now with the vaccine and some of these things, hopefully we can kind of take back control of that and have some forward progress instead of just trying to put out fires and all that.
That's very informative. I didn't know a lot of those things. I mean, that makes me kind of feel for the families that have experienced COVID and shipping them off to Oklahoma, and like you said, they're going by themselves, and then going to Phoenix and things like that. And then especially with the times we're in, how the economy. I mean, you just can't fork over however much, $200, $300, $400,
Yeah.
$500 to go to those places and stay in a hotel room.
Right. And
I mean-
and maybe even having a disruption in your benefits as a result of unemployment
Right.
or something. I mean, that would be huge.
Yeah.
And especially if you're taking an airplane ride for a transfer to somewhere else, and hospitalization in another state, and coordinating the insurance benefits between all those. And if you didn't have insurance as a result of unemployment or something, I mean, that would be a really terrible,
Yeah.
complex environment that you're having to operate through while you're sick. I mean, I can't imagine. So
It
that's,
just puts more stress, which, they say the more stress you have, the sicker you become.
yeah.
We've been able to continue business. We've kept our complete workforce. We haven't had to do any cutbacks at this point. We did qualify for one of the PPP loans up front, and that's helped us. How about y'all? Y'all maintain workforce?
We had one guy move in March, so we have not had to lay anybody off,
Just attrition.
which has been great. We did get the PPP loan in April, I believe, which was beneficial. I was worried whether I should take it or not at the time.
Me too.
And the biggest thing was, right now we were good. Yes, we were deemed essential and we were still working. But I was worried about come July and August what would happen. And we did take a larger nosedive, as far as business-wise, later on in the year, more so than I expected. I mean, the oil field got hit with the double whammy of prices were coming down anyway, and then the coronavirus killed demand. And so it really did get tough. We were fortunate. We had good customers. We had good relationships, and we've still been working, just not as much as we were.
Yeah. One of our challenges was we signed on with the FCC. They asked that we not disconnect anyone for 90 days and try to give people a chance to work this out. We went through that, which impacted our cash flow considerably.
I can imagine. I've heard that some people didn't get the first go-round of loans because the money disappeared so fast. The ones that did, and unfortunately, like restaurants that still can't open, it got them through a little bit, which is what it was intended for, but now they're still not able to open, and not many people want to sit on patio in 30-degree weather in New Mexico right now.
Especially when the sand's blowing.
Yes. So I feel that's really bad for restaurants that aren't able to operate at all. It's, I don't know how they're going to make it, and especially if they've already spent the first bit of the PPP loan to get through the first bit.
I definitely do have restaurant clients. And how do you go from zero income? I mean, right now, a lot of them are questioning whether they can open back up. You can't do this on again, off again. You can't say, okay, restaurants, businesses, open up 2 weeks, and 2 weeks later say, nope, you got to shut back down. Regular business like my type of business, where I don't really quote unquote have to order things, it's not near as hard to do some of the things that we're doing. Restaurant, they have to order. It may take them 5-7 days to get in food, and then you tell them 2 days later they're shut down again. There are going to be, sadly, I think a lot of businesses that will not survive this. I've got several already close their doors. They won't open again. And we don't have replacements for that. So the community as a whole, we lose. We lose.
The first thing I did when they were talking about shutting down businesses was to see whether we were deemed essential. And I can honestly say, praise God, we were deemed essential because we service a lot of restaurants and residents and things like that in the septic industry. People have to have a place to go to the bathroom, because if you don't get that serviced and taken care of, it's going to back up in the home and it's going to cause more issues.
Yeah.
And it's unsanitary. I think a thing for me, being a small business owner, is seeing other non-essential business owners have to put up with the regulations and the things that they have to go through just to try and open. And even then, they may not be open long enough or be able to serve enough people to come out on top, especially if still having to pay employees, having to order food, material, and then the PPP and things like that. it just becomes a strain.
We talked about broadband, and one of our challenges, the demand out there, especially in the rural areas, is just huge. And one thing I wish the state would entertain, the federal programs are really putting some money behind this to push it out to rural America and unserved areas. They put another over $700 million in with this last signing. Trump signed the bill. And over $600 million of that is going in the Reconnect program. And that is directly to put broadband into rural America and unserved areas. But it requires, anytime you go in for the grant, it requires a 20% match. Well, if we're looking at a $6 or $8 million project, 20% for a small company is a big challenge for us. If the state would step up and help with the matching funds, that's a way to turn their 20% investment into something huge. If you put in 20 and you get 80 for it, to match it, that's pretty awesome in my book.
That's a good bit of money.
And the government's making the program easier to get into. They're making the requirements. It was 10-1 to be unserved. Now they're going to move it to 25-3, and it'll get a better service out there. You know, I'm hearing out of kids that are 20 miles out of town. They have to drive in, link up to a hot spot, and we've deployed quite a few of those around. We've got one here at the chamber. They can pull in the parking lot and get on free service there. We've got, I guess, about a dozen of them deployed in the 3-county area to help the kids. But it's not convenient if the parents have to load them up every night, take them in and sit in the parking lot while they do their homework. It's a challenge.
Take nothing away from what I call large box stores. They don't do for the state, they don't do for the community what our small business owners do. This money has helped. These grants have been essential to keep people's doors open, but it's a Band-Aid. It's not we got to figure out the way to go to the next phase. And again, I'm thrilled. It sounds like you've applied now for the Paycheck Protection Plan, the PPP, round 2.
No, I haven't applied for that one yet.
But you will, or you're planning on it.
I'm planning on it.
Okay. I highly recommend anyone that can qualify for that, whether you got in on the first one or not. Obviously, like a lot of people, and I will tell you that worked. I have talked to a lot of business owners who didn't feel the need in the first round because in April and May, we thought this was going to be 8-12 weeks and we were done.
Yeah.
And now we're roughly
agree.
9 months, going on 10 months down the road, and we're even more shut down now than we were then.
We need to find a happy medium with the restrictions, because us being here so close to the Texas state line, if we can't go to the grocery store here, what are we going to do? We're going to go to Lubbock, we're going to go to Midland, we're going to go to Odessa. Some people even go as far as El Paso.
The dollars are going out of state.
So the number of cases in those cities are high as well. Plus we lose, the state of New Mexico loses the GRT.
It does, and the business owners lose the income.
One thing that I've learned is it's hard to find good employees. You can find employees anywhere, but to find those few that are truly good employees that you want to keep, and you'll even go a little extra and pay them 2 or 3 weeks, maybe even a month after the fact, knowing that in a month that you may not have anything because you want to keep them with the hopes of opening, and then it come to find out that that you're not going to open. It's like, well, heck, now I got to break their heart.
I can't even imagine having to go. Some of our local restaurants and some of our local businesses where it's been shut down, and so you have to take some action to respond to those changes, and then comes back, and so you got to rehire or bring those people back.
Right.
Some of those people come off those unemployment benefits, and then only to be shut down again. And then so it's really kind of back and forth.
The up and down.
There's no way to plan for that or try to be successful in managing a budget or operational efficiencies or anything like that.
Because in the current situation we're in right now, it's just rolling and rolling and rolling, and it's either more or it's less. You don't know what to prepare for. Like you said, the small businesses don't know what to prepare for, what they need to do, what they don't need to do.
One of the other areas that is of real concern here, and my understanding is that you're on the Lodgers Tax Board, is what's happening with the lodger's tax? I mean, we know that's part of the problem is we've required shutdowns and then minimal openings for hotels, motels.
Yes, that's correct. I am on the Lodgers Tax Board, and I'm also president of the Hobbs Hospital Chamber of Commerce Foundation, and we have 2 big events, and the purpose of the foundation is to give scholarships. Well, this past year, of course, with COVID, we didn't have any events. So our scholarships, I don't know what we're going to be able to give this year. Being on our largest tax board, I mean, we've had the chamber here, you know, the Hobbs August Nights and the different events, the Hobbs Holiday Tournament. We didn't get that. We didn't have them this year, so we're not having the event. So we don't get the money in. We don't get the revenue from people staying in the hotels. All of the softball tournaments that they had, hundreds and thousands of people come every year. We got a great facility out here just down the street, and they're not being used because
The shutdown.
because of the shutdown. So we haven't had any requests from lodgers tax because we can't have the events. Yeah.
So we're grateful for the governmental help that we're getting, the grants and the things of that nature that we are getting. But at some point, again, services are going to suffer. And I'm heartsick because I feel the same way about the scholarships. I mean, that's what these fundraisers are for, is to help with the scholarships.
Yeah, the students, the kids, the graduating seniors are the ones that are going to suffer because, I don't know, we've given over $150,000 in the past 10 years. So,
Oh, that's wonderful.
So, how
And now
much
it's
will we
hurting.
give that this year? We got some money, but I don't know.
These are the secondary actions that happen that I think, you know, I'm not taking anything away from this. The numbers, you know, death is final. It's hard to argue on one way or the other, but the reality is we have to look at the cost. We have to look at what is happening outside of just directly. What are the shutdowns continuing to do? A lot of other numbers, a lot of other factors that I think now need to really come into. Again, businesses, what does this mean for a future? I think it's really sad what some of our kids are having to go through. Colleges cannot have any sports activities of any kind. They can't get together. They're now limiting them. They won't even let them get together in groups of 5 anymore. I don't know how. So you're bringing a lot of question for future, and then the kids have questions of what they're doing. And again, I think it's sad. The kids need the education. Some of them, the only way they're going to get it is through athletics. It's just sad.
Yeah.
But at some point, there has to be a scale of how do we, and I don't have the answer. I'm not going to sit in here and say I have the answer. But I'm going to say clearly what we're doing isn't working.
Yeah.
So somewhere in here, there has to be that scale, because it's fine and dandy to say, okay, we have the numbers coming down, but unemployment skyrocketing, business going out skyrocketing, suicides skyrocketing, mental health issues skyrocketing. At what point can we find the balance?
We were, through the New Mexico Hospital Association, providing twice weekly data to the governor and her office and the Department of Health so that they could ask specific questions around what have you restricted, how are you controlling these, what services are you scaling back, and how often by day. So we would measure it and report it by day, in addition to all of our other reporting requirements, where we've had to create extra positions in our hospital, employ people just to report to the government what we're doing, which we could have used those dollars elsewhere to take care of people. Which is frustrating, but we were reporting on a daily basis to the governor and the office at the state how we were restricting things, what we were restricting, and I believe all of us. I know several of our facilities that we were associated with that were owned by the same company prior to being converted to or acquired by Covenant, we were all had significant restrictions. I was on weekly calls with all southern New Mexico hospitals with weekly restrictions. So in many ways, we were doing all of those things required. But then in December, we decided that we were the governor decided to shut down all elective surgeries. So I don't know what the cause was behind that, or for 4 weeks, right at the end of the year, where people are trying to get as many of those services done as possible. And we already have in place all of these restrictions that we're telling her on a daily basis. Here's what we have in place. Here's what we're doing to make sure that we're safe. We test every single surgical patient prior to getting surgery to know if they have COVID or not. So we know that everyone's negative. We cancel those that are elective before they're done. So we take tons of precautions, have changed tons of our operations. And then the one service line really that makes money for a hospital, we shut down at the end of the year for 4 weeks just for whatever reason.
Yeah.
So there's a lot of frustration, and it's not communicated. It's just an executive order of do this.
Just shut it down.
And so it's frustrating when we're attempting to do everything plus more, and I can't even imagine. I mean, this is not my pocketbook that's affected as a result of the hospital. This is but on a business owner side, I can't even imagine the frustration and that environment that they have to operate in.
The whole field's depressed. We got the double whammy. Like I said, it's tough when prices were going down anyway, but then the demand gets cut out from under us. It's unfortunate that a lot of people are not working through the pandemic, but I think we're luckier here in the Permian Basin that we still have a lot of jobs. And this is where a lot of the activity is. So we're blessed to be here compared to other parts of the oil field.
Definitely.
Here where we live, it's oil. Oil is king. Whether if you own a restaurant or mine, a printing company, or the grocery stores or whatever.
Will your business begin to pick up if things start going back to work?
Oh, definitely. As soon as people start traveling, whether they're driving or flying, and the oil starts being used more, then yes.
We don't see the GRT.
Yeah.
You're seeing it just because you just closed your books out, and you're seeing from an overall perspective.
Yeah.
We all have down years. The problem right now is not knowing what the future is, and I think that's the unknown. I love your attitude. I think we all have a great attitude. We're in this together. We're going to get out of this together.
Yeah.
The GRT is not there. Gross revenue, gross taxes, gross receipts taxes. They're simply not there. They're not going to increase at this point. Government's going to have to cut back, which means our services in our area are all going to suffer. And we're not getting the same level of service. It cannot be done with fewer people.
There's going to be a lot of good and things to look forward to, both for the employees in the hospital, the caregivers there at our facility, as well as the community. And I think that partnership with Covenant is going to be one that really serves Hobbs well. And so that's why I decided to stay through the transition. I have a lot of faith in the future with Covenant. Not only are we transitioning currently and acquiring the hospital, but we're also breaking ground very soon on the new facility that we'll be building here in town. And so through a great partnership with the city and everything, with Covenant, it'll be a really good transition for us, where we'll be able to provide really high quality care. And I believe that for a long time we've done that and provided some high quality care to patients at Lee Regional. But now having a regional partnership and a high level of investment from a regional partner like Covenant is going to serve us really well and serve this community really well.
Yes.
A large percentage of patients who are served by Covenant in Lubbock are from southeast New Mexico. And so if we can retain some of that here, then I think that will be a big benefit for people being able to provide or receive high quality health care at home.
Right.
To the point of COVID affecting our operations, we really have a shortage in healthcare providers. As I said, it's put a strain on us. That also, for nursing staff, we could staff more beds, but we have traveler nurses who come from other areas. So we have a high percentage right now of travelers who are working in our hospital. That's not ideal because they don't live in your town. They just come here for a short amount of time. And so we'd like to have more full-time providers, but we will be able to open up and have more availability for full-time providers to come in our doors and be a part of our Covenant Health Hobbs Hospital. And we've had that for a while, but I think that people are excited about this change and transition, and so it'll serve us well and be really exciting for us in the future.
Awesome. I'm looking forward to it.
Yeah.
I mean, I ain't been to a hospital I don't know how long, but
Yeah.
I just think about the elderly and
Yeah.
those people having to drive. Like my mom, she had to drive to Lubbock to get her heart and whatnot checked
Yeah.
out. So, and if she's able to just drive here
Yeah.
to get that same level of care,
Be a lot better.
that's even better.
We were just talking to Patty and Berla up front, and I feel for the parents because I would not want to be a parent with a student in school right now.
It's difficult, I imagine. I don't have one either, so I imagine
Because
I see it the same way you do. Very, very difficult. Again, teachers, oh my God, teachers, bless your hearts. You know, just so much respect for teachers right now.
so my grandson, he lives in the Dallas area, and he goes to school every day. So,
Yes,
and he's fine.
yeah, yeah. And the numbers support that. The numbers support that. It's fine that we're doing some things right now. This will have a domino effect going forward. I think that's legislatures, this is kind of what we're talking to you about. We're not talking about just the immediate 3, 6 months, or possibly a year. This is going to have a domino effect for 5 to 10 years. So how do we mitigate that? What do we do? And it's not, I know you're going to have to raise some taxes. We have to really take a look at services where we can change what we're doing without causing the hardships that I'm afraid are coming.
Well, Russ, it's so good to see you. I'm happy that you were able to make it here, and I hear you've got a report for us.
Yes.
To talk about a little bit and help us spread the word about the importance of all these issues.
We have been working for a year and a half with Xcel Energy on the New Mexico Xcel Sagamore Wind Farm project. It's a $900 million project, 522 megawatts that could basically, if they had to, they could power a third of the New Mexico homes through one project. It's the largest wind farm project to date in New Mexico. And when Xcel first began going through the Public Regulation Commission process in 2017, they went through and got the approvals for right-of-ways and things like that. And after that, the Attorney General's office got involved, and they said this would be a good time to increase the renewable energy workforce in New Mexico, because there is a huge amount of future solar farms and wind farms to be constructed, and the workforce just isn't there yet, and everybody knows that. So what they wanted to do is create an agreement with Xcel and the contractor to hire a business sourcing advisor, and they hired Sauder Miller Associates as a business sourcing advisor to identify New Mexico firms that would be able to work on this project, and then with that gain experience on wind farm projects. The second part of it was to reach out to the educational institutions in New Mexico to find out who is doing renewable energy workforce training and find out what they're doing, and also at the same time research the workforce needs for solar and wind farms and try to see what the gaps in the training are and make recommendations to these schools that they could increase the certain parts of their training that would be more effective. We prepared an extensive report and regarding what happened on the use of the Mexico firms. We do have a list of recommended firms, but and we worked with the educational institutions, and they asked us for a set of recommendations. We also contacted the apprenticeship programs, and so there's things in there about that. So we came up with a set of recommendations. The report either should be in your hands already, or if it's not, it should be shortly given to be able to follow along with these. Out of 9 proposals or 9 recommendations, 6 of them closely track with the New Mexico Chamber of Commerce report. That driving New Mexico's future, empowering a competitive economy in a post-pandemic world, 2020. So we took those and looked at them, and they're not exactly the same, but we said, how could this be used and specifically tailored to renewable energy?
My hat's off to our healthcare providers, 100%. They walked through fire, in my opinion, to do this. So have our teachers, but also so have our small business people trying to stay afloat and keeping people working. You've walked through fire trying to keep these things going. So at some point in here, do we get out of the fire? Or does it finally consume us? I don't have an answer for that, but the breaking point is there.